We know there's nothing better than a visit to Grandma and Grandpa's, but unfortunately, due to the COVID-19 pandemic, we've had to keep our distance. We know that older folks are at higher risk of complications due to COVID-19, but doctors say that careful planning and precautions can make it possible to visit older relatives safely. Wake Up Charlotte anchor Carolyn Bruck is here to explain why it all starts with assessing our own health.
Do we have any symptoms of suggestive of coronavirus? And if we do, it'd be important to have ourselves checked and also be very judicious about waiting so that the symptoms are not with us for a good period of time.
Cleveland Clinic's Dr. Ardashir Hashmi says it takes time and meticulous planning, but once you've been symptom-free for 14 days, take a close look at who you're visiting and their health status. According to Dr. Hashmi, there are a number of medical conditions that put an older individual at higher risk for contracting COVID-19, including medications that suppress their immune system, any type of lung or heart disease, and cancer. If your loved ones have multiple conditions that put them at greater risk, the doctor says it is best to reconsider your visit. When visiting nursing homes or assisted living facilities, you're going to want to check and abide by all social distancing and masking requirements. If you're traveling out of town to visit grandparents, be aware of any and all restrictions in that particular city or state as well. And when you arrive, the doctor says outdoor visits are best, but if you must be indoors, try opening a window to increase fresh air circulation. He adds that time spent with grandparents is emotionally and socially beneficial for everyone, but will require extra measures to keep them safe.
Still a visit, but a different visit where the solid core guidelines of frequent hand washing, hand sanitization with alcohol-based preps, safe measures with social distancing, so at least 6 feet away. Wearing masks, I think, absolutely key.
For families traveling long distances to see older relatives, Dr. Hashmi says it's a good idea to carefully think through logistics. He says traveling by car may mean fewer interactions and less exposure to other people. Also, be sure that proper safety measures have been put in place by hotels and airlines that you may encounter along the way. Carolyn Bruck, WCNC Charlotte.